So what I wanted to find was something that gave the body the ability to heal itself on a more natural basis. And that's where I started actually studying stem cells probably 10 years ago.
Welcome to Beyond the Labs with Matt and Amy McKinlay, where we stop chasing lab numbers and start building real vitality. We challenge conventional medicine, talk business, hormones, and longevity, and help you think differently about what it really means to feel good. Let's go beyond the labs. Welcome back to Beyond the Labs with Matt and Amy. Today we're going to be talking about something I'm excited about. We're talking about stem cells, what they are, and why we're so excited about them. And it's probably one of the most misunderstood topics too out there. So we hear this question all the time. Do stem cells really work? Can they really regrow tissue? Are they safe? Is this science fiction or is this real medicine? So today we're going to go break down all those issues. Matt has spent over 25 years doing orthopedic medicine. And
25 years prior to starting this.
Yes. He's old. Just kidding. So Matt's going to tell us today a little bit about what got him interested in stem cells after practicing in total joint, knee replacement, sports orthopedic medicine that he practiced in many years. What got you into this stem cell journey? How did you stumble upon it?
Well, I wanted to look for better options. And when I say better options, I am not at all hacking on orthopedics because I love it. I did it for 25 years. It was a massive part of my career. I learned a ton from a lot of really good people. And shout out to all the doctors I worked with. I love you guys and appreciate you sharing your knowledge that I can pass on to others. But I really wanted to look for something that was different because the model in medicine these days is very simple. You're referred to orthopedics, you get x-rays, they put you on nonsteroidal anti-inflammatory medicines. If that doesn't work, they give you corticosteroid injections. If that doesn't work, they get an MRI. There might be some physical therapy spliced in there somewhere. And then the end result is surgery. So surgeons operate, surgeons love to operate, and that's what they do. And I did that for 25 years and actually really enjoyed fixing things. But I also saw a lot of frustrated people where if surgeries didn't go great, they had no other options. They're stuck. So what I wanted to find was something that gave the body the ability to heal itself on a more natural basis. And that's where I started actually studying stem cells probably 10 years ago. A lot of research and data. I kind of read everything I could. Some of it on the internet is good, some is bad, so you got to be careful, where you're sourcing it. This is a very, very exciting evolution of modern medicine, and insurance does not pay for it. So if you have that question, just know that. And I believe it's because it works so well that insurances don't want it to work. Big pharma especially doesn't want it to work, but it does. So yeah, insurance doesn't pay for it, but we've seen some really remarkable and almost miraculous things with stem cells.
Yeah. And I think something that people hear is they hear the word stem cells and they immediately think something kind of like magical or something. They don't know really what it is. And so can you explain to me what stem cells really are?
Yeah. So stem cells, the ones I use, come from umbilical cords. You might hear the word Wharton's jelly out there. So it's the tissue in the umbilical cord that surrounds the vessels, and it's extremely rich in regenerative properties, proteins that help build and rebuild tissue. There's also proteins that really kill inflammation. So one of the reasons people feel really good after stem cell treatments is that their inflammation markers go way down, which causes pain. So inflammation equals pain. Decrease the inflammation, people feel better. They come from sources that are tested 3 times. They're tested twice by one company and third by an outside source. They're tested for sterility. They're tested for disease, bacteria. I actually get about 3 pages of various things they've been tested for before they become approved. And although I'm not a huge fan of the FDA, these cells are FDA registered, meaning they've passed all the standards to get that stamp of approval for sterility.
Yeah.
And
I also think
set to
you
go.
need to make a point is, they come from live C-section births. So there's nothing with abortion or anything like that. So if that's, an issue, there's nothing like that. They're all donated live C-section umbilical cords.
Yeah, I get that question a lot. And it was my first question is, where are these stem cells sourced from? Because I would have no part in anything like abortion or anything that's fishy in my mind. These come from live birth C-section, so the umbilical cords don't even pass through the birth canal, so they're preserved at a very high level.
So let's also talk about who might be a candidate for these stem cells. We have people all the time come in and wondering if they would be a good candidate for stem cells. So Matt, can you help us understand who would be a good candidate for these type of procedures?
Yeah, it's a very broad range of people. Usually people or patients or clients, whoever you want to say it, we're not their first stop. Sometimes we are because people are getting more educated. Usually they've seen other practitioners that have suggested trying medicines or shots or other things that haven't been effective, so they end up in our clinic. And really it could go anywhere from arthritic changes, shoulders, knees, hips, ankles, backs, necks, musculoskeletal injuries, tendons, muscles, also just injuries. So we'll see patients with arthritis, but we'll also see younger athletes that have had injuries, and it's really been miraculous to see how more quickly they heal and get back into the game. But with, let's say, people that are a few years along in age, arthritic conditions, joint pain, stiffness, back, and especially back and neck, we're seeing more and more of that all the time. After they failed other treatments, stem cells are a great option.
Yeah.
There's also stem cells that can be given IV through a vein for chronic conditions such as rheumatoid arthritis, lupus, anything that's autoimmune. Stem cells really seem to help with the symptoms these patients are having.
Yeah. So Matt, can you tell us what an office visit looks like? If someone comes in, what that looks like?
Yeah, so I take the office visit extremely serious, and I schedule a full hour for these visits. I want to get to know the person, what they've done, how long the condition has been present, what treatments they've had. So we go through all of that. I also like to look at x-rays or MRI scans if available. And then we decide if this patient is a candidate. So it's not for everyone. Most people, when they hear about it, really want to do it because it just makes sense. It's the body healing itself. We do a very, I would say, conservative but yet aggressive screening process. With my experience in ortho for 25 years, I can diagnose things fairly quickly and then see if this is going to be something that's going to help the individual. If not, I won't recommend it. Not everyone gets a treatment, but those that qualify, definitely, we can do it same day in that hour. And then I also have protocols. So after, let's just give an example of a knee. So if we're doing a knee treatment, we'll do the injection the first day if the patient meets criteria. And I'll see them back in about 2 weeks to do a second treatment. So they're getting 2 doses of stem cells into a joint or a back or wherever it may be going. We do the same thing with IV treatments. That's something that I found has been the most effective. When I first started doing this 3.5 years ago, I would do one treatment and then see them back and decide if they needed a second treatment. I've just found that most people do much better with 2 treatments. That's something we do differently than other clinics.
Yeah. So there's a question that we often get asked from some of these patients is, can stem cell therapy help me avoid surgery? What is something you can tell them on that?
Absolutely, and not always. I couldn't count the amount of people that have come in for trying to avoid surgery and seeing if stem cells will help. And it's been countless patients that have actually canceled surgery. I can give you one quick example of a lady, and she is now about 3 years out from her treatment, but she had a knee replacement scheduled. She was in her 50s. She had trauma to her knee from an old injury and had just gotten worse over time. to the point she was nearly bone-on-bone arthritis in her knee. Well, she came in for 2 treatments. After the first treatment, she actually canceled her surgery. She was feeling that much better. After her second treatment, about 2 weeks later, she called me and said, I was in the dome. Here in Idaho, we have domes because it's cold weather, but she was walking the steps in the dome at a wrestling tournament, holding a grandson that was 3 years old, going up and down steps. She said, there's no way I would have even considered going to the tournament, let alone packing a youngster up and down steps. So that's an example of something that we see. I'll give another example of a shoulder patient, and this was pretty miraculous, and I've seen this 5 or 6 times now with frozen shoulder. So frozen shoulder is when the joint gets basically stuck. It won't go through a range of motion. The patient can't move it very far, and even if I try, I can only move it so far. So the joint and the capsule are basically stuck. I've seen this again 5 or 6 times, but the most recent one, we did an injection on a gentleman in the Boise area. Within 24 hours, he had full range of motion in his shoulder, meaning he started here. Now he could come through a full range of motion. He said it was the first night he had slept in 6 months, and just really miraculous recovery. Now, I can't claim that's going to happen to everyone, but when it does happen, it's pretty awesome.
I love that. I love that we focus on realistic expectations. Stem cells aren't a miracle, but they can be for some people. But it can be a very powerful tool. So, let's talk about safety, because, that really matters. Tell us a little bit about safety of stem cells.
I'm going to knock on wood. I've never seen an issue with injection of any of the stem cells that I've done. I think it's because of the source we use. We know they're sterile. We know they're protected, as I mentioned earlier. But it's important to find a provider. If it's not me, find someone that has a background that knows sterile technique, because that's essential. It's cleaning the area that's going to be injected, just as if they were going into a surgical procedure. So avoiding all possibilities of infection, that's the biggest side effect. But as far as reactions, I've never seen any bad reactions to this point. Could there be? Yes. Could there be an infection? Yes. With any shot, there could be an infection. It doesn't matter if it's a vaccination. Anything can cause infection if you're piercing the skin. But we take steps to do everything we can to prevent that.
Yeah. And I think it's important to for people to understand that, regenerative medicine isn't about masking symptoms. It's about trying to support healing at the source. And that fits perfectly in, what we're talking about, what we talk about on our podcast episodes. One thing I want to bring up is, we try to keep people away from interventional pain management. It's one of those things where interventional pain management, what that means is that it is using typically, a Kenalog or corticosteroids directed through fluoroscopy or other means, pain stimulators, things like that, to mask the symptoms, because that's what's happening with interventional pain management. That is something we don't do here, and that's something we want to keep people away from. And so that is very important to us, and that's what we're trying to do. And I think a lot of people have been suffering, and Matt has had a lot of experience with operating on people that have had multiple Kenalog or corticosteroid injections into their knee joints or shoulder. And he told me, the tissue doesn't look good. It looks broke down.
Yeah. So on Amy's point, we try to do things to regenerate and not degenerate tissue. Corticosteroids can actually degenerate tissue. And by that, I'll give you an example of knee replacements. We see knee replacements where patients have been injected time and time again. It gives them a short-lived pain relief. But what it is actually doing is breaking down the cartilage inside the knee. And I saw it firsthand. A beautiful cartilage in a knee is kind of a pearly white. After multiple corticosteroid injections, it ends up being a dingy yellow with pits everywhere. It's called corticostaining or steroid staining. And that's another one of the reasons why I'm like, wow, isn't there a better way that we can treat people? So I understand fully that that's an option for people. We just think there's better ways to do it now. I'm not saying we're against it, but we think there's better ways.
Well, and the thing is, it's insurance-based medicine, and that's
Correct.
what insurance-based medicine does. Yeah, they'll approve corticosteroid injections and degrade your knee, so you need a knee replacement in the future. So think about that, guys. Think about that. It's all the insurance companies really kind of rule the world on that. And in these interventional pain specialists, what they do is they herd people in like cattle, literally in for shots. And that's what they make their money off of. And it's about the money. If you want to know the truth, it's all about the money. And one of these days, insurance companies are going to kind of understand kind of what these interventional pain management specialists are doing, and they'll figure it out. Reimbursements will kind of go down, and then they won't herd people in as much because it's not going to repay as well. But that is exactly it. And I'm just telling the honest to goodness truth. I've seen it. I've worked in this medicine. I've worked in this type of medicine, and it is one of those things, and it's kind of sad. You'll get some good specialists out there, but most of them are all about the money.
Yeah, there are some really good specialists in that field, and one comes to mind that I know personally. He actually cares about his patients. He'll spend time with them, explain it. But I know others where they don't even see the doctor until they're in for a procedure. That happened to me. Didn't see the doctor ever, even after the procedure. They just called and said, "Do you need another one?" So that can be a pattern. I don't like that because it's really not taking care of the patient more so than the way Amy said, it's herding through like cattle.
If you want to say it what it is, that's exactly what it is. And you can say it, say it however you want. I'm just telling you the God honest truth on that. So whatever, see it how you want, but it's all about the dollar.
Yeah. How many patients can they do in a day?
Yeah.
Yeah. I saw it where there were like stations. You would go in, check in, get an IV, talk to a nurse. You're laying down on the table, draped before the doctor even comes in the room. And then the shot is done. They herd you to the next room, take the IV out. As soon as you're fine, you're out the door.
And they're masking symptoms is what it is. No, well, the thing is, you want to talk about you're masking symptoms. You're not fixing the problem. You talk about bulging discs and backs. This is what these pain management specialists do. These interventionalist pain management, this is what they do. They go in and do an inject.
They prescribe chronic narcotics, and that's a big problem. We know the narcotic epidemic in America has become a massive problem. We just want to make it clear we're not about that.
We're not about that. We understand pain exists, but there's a lot of different ways to manage it. Whether we're talking about hormones, weight loss, peptides, or regenerative medicine, we're always looking for the root cause. That's what it comes down to. We're always looking at the signal.
Yep. And with stem cells, we're looking for the best healing environment where the body can actually heal itself. Stem cells also signal the brain to release your own cells to heal. So that's a big part of it, which will lead to better function and my favorite 3 letters, QTR, quality time remaining.
Before we wrap it up, what's the biggest misconception you'd like people to stop believing about stem cells? What is it that people now believe you want to clear up?
So what I would like to clear up is they work. They're real. They work. It's not voodoo. I also want to clarify it's not always magic. It's not like a magic that you touch and everything is perfect all of a sudden. I was skeptical at first. I had to become a believer in seeing it work in my own patients and actually in myself. I've been injected multiple times with stem cells and had great results. They're not only for athletes, they're for everyone. In fact, I probably inject athletes the least amount of any patient that I see. They're not just for severe problems. So do they help severe problems? Yes, but if you can get to it before it becomes severe with stem cells, that's a great way to go. And it's not a guaranteed cure. Although I would say every patient I've treated has gotten some relief. Sometimes it's miraculous, sometimes it's really good, and sometimes it's moderate. But the people that even get moderate relief seem to be very, very happy because they're much better than where they started.
The goal is really to help people feel better, move better, maintain their quality of life, and, as much as possible. So if you'd like to learn more about regenerative medicine or find out whether stem cell therapy is right for you, call or contact our office, DM us, message us. We'd love to give you information.
Yeah, and remember, healing is possible. Hey, guys, thanks for tuning in and joining us. Hopefully we've been able to help you with some questions you might have had. Feel free to reach out. We'd be happy to help you in any way that we can.
Thanks, guys.